Hi, it's Doug from Rise Above Performance Training. In this video, we're going to go over tips for people that have had major injuries in the upper body that required surgery or physical therapy. So you finish your therapy program, and now you want to get back to your traditional weight training program, but you don't know where to go because that transitional period is there, and you still need to rehab your upper body. So I'm going to show you some tips to do so. Tip number one, you got to do it yourself. So you're on your own now, you have to make a dedication to do the remedial exercises and do them daily to get stronger. Tip number two, if you like some of the movements that you learned in physical therapy, bring them with you. A lot of the mobility drills are great to keep the range of motion. You want to keep that range of motion that you had to be strong all the way through. The third one is we're going to do some high rep band work, and then we're going to do some isometrics. So I like high rep band work because it doesn't put a lot of load onto the areas, and also you can get a lot of reps in, and it strengthens the movement throughout the movement with accommodating resistance. So let's say we have a shoulder injury. So we can do the basics, which are, we can work some external rotation, tucking the elbow in and moving out. We can do internal rotation. The shoulder moves in so many angles, we just want to move in as many angles as we can, tucking in and moving out. You can do simple pull-throughs or extensions. We're just going to pull through. Make sure you don't pull with the body. Get a little stretch here and pull through. And we can start working front with a raise right here and controlling here in opposite motion. Another one that's a little more aggressive with the shoulder injury is learning to go overhead again. I like the band for that as well. Get a band with minimal tension, wrist overhand, and you're just going to bring it over your head. Now, what you don't want to do is lift the whole body, so you want to kind of keep your chest down. And don't pull the band apart either. It makes it a lot easier. I'm just going to use the band for support. Get a little bit of a stretch here. I might have one shoulder that's going to rotate more than the other. I only want to go as far as my limiting shoulder will let me, and then controlling back. So for these high rep exercises, I'm going to do them for about 15 to 20 reps. They do take a lot of time, so you can do 3 sets on the injured side and 1 set on the good side, and then you'll be pretty balanced. The next thing you want to do is isometrics. Isometrics are a little bit more common in the lower body, wall sits and things like that in physical therapy. They don't do them so much for the upper body, but I think they're a good way to build strength and joint integrity. So you can start with basic isometrics by simple holding of the weight. So you want to pull the shoulder in the socket and just hold. So you can hold out that way. You can hold out this way. And you can even work your grip, and you can hold this way for a little bit of joint integrity. Any motion you can really think of. So that's kind of the basic way. If you want to get a little more advanced, you can use the kettlebell. If you're getting really good, you can hold bottoms up, work the shoulder and rotator cuff. And then when you're ready to go overhead holds are very good. You can do a farmer walk with them, or you can simply hold them for time. Use 2 hands to bring it down though, because the arm will get very fatigued. Some more advanced isometrics, so make sure you progress to this level, are going to be push-up position ones. And you can do it at 3 different levels. So the top level is more like a plank. You're going to be in this position. You'll roll the shoulders in and kind of hold, and you can hold here. So this is a little bit easier than the next one I'm going to show you. When you're done, bring the knees down though. You just don't want to push right back up because that shoulder's been on stretch for a while. Second one, you can hold a little bit lower, and then you can get even lower just above the ground and hold. So I would hold here 10, 15 seconds max. I'm going to drop down to the floor, release my shoulders, and then come back up. So that's a good way to build up the pec strength and the shoulder. That's a closed chain movement because your hand's against the floor. It's going to compress the joint a little more, so it's a little more aggressive. Make sure you're ready for that. This one here is my last one I'm going to show. It's going to be a dip, and it's also, you can do this isometrically in 2 positions. Again, this is aggressive. I probably wouldn't have an overhead athlete really do this because it does pull the shoulders back. But if you're a grappler or some other type of martial artist, you may need to have the shoulder mobility in this range. So one you can do is just simply up here. I'm going to roll my shoulders back and just hold and grip here. When I'm done, I like to have a nice box or something to step back on so I'm not dropping to the floor and wrenching my shoulder. Then the very advanced way would be to hold at the bottom. So again, I'm going to get up, pull my shoulder blades back. I'm going to control my body down, keep my grip in tension, hold. Then when I'm done, I'm just going to roll back and back. So I would do about 3 to 5 sets, 5 to 10 seconds, and that'll build up a lot of strength in the areas you need it. So give those a shot, and we'll get you back to where you want to be. Thanks.